the blood vessels around the heart. So basically the blood vessels that deliver blood to the heart are called coronary arteries, and the one coronary artery you can see branching off the ascending part of the aorta is the right coronary artery. So here it is. And the right coronary artery will branch on the heart's margin, which is the edge, because it's called the marginal artery. Okay, so it goes back. The right coronary artery will extend back, wrap around the back, and then go down. So this is a posterior interventricular artery. Okay. You can see that beside the posterior interventricular artery is something called the middle cardiac vein. If we come around here, on the front we can see that the left side of the heart gets blood from the left coronary artery, which branches off the aorta here, but you can't see it because it's underneath this pulmonary trunk. But you can see it popping out here. So, and then you can see one of the branches goes down the front of the heart, so this is the anterior interventricular artery, and then the other branch goes wide around to the back, and that's called the circumflex branch of the left coronary artery. Okay, so circumflex artery. Alongside the anterior interventricular artery is something called the great cardiac vein. Okay, so the branches of the great cardiac vein. We go over to the back. The great cardiac vein continues around. Here is our middle cardiac vein, and everything comes in and drains into this coronary sinus. Okay? So the coronary sinus will drain blood into this right atrium. All right, so that's basically all there's only around 6 blood vessels there. Oh, one more. Did I talk about the small? This is a small cardiac vein. Okay, so alongside the marginal, there is a small cardiac vein. And there are other little veins. These are called the small anterior cardiac veins. There's only one here, but on this heart, there's actually several here. That's 2. And they drain directly into the right atrium. Okay, so those are your anterior cardiac veins right there. Okay, so then on the heart itself, we have really big blood vessels, right? So this is our superior vena cava. What drains into the superior vena cava are the right brachiocephalic vein and the left brachiocephalic vein. Then we have also the inferior vena cava here. And then we have the aorta, right? So we have the ascending aorta, we have the aortic arch, and we have the descending aorta. So we talked about the right and left coronary arteries are a branch off of the ascending aorta. The branches off of the aortic arch are the brachiocephalic, okay, artery. Then we have the right common carotid, and then we have, left. Thank you. Left common carotid and our left subclavian arteries. Okay. And then we have, what else? This is the pulmonary trunk. The pulmonary trunk will deliver blood to the lungs, branching left and right. So this is the left pulmonary artery, and the right pulmonary artery is on this side right there. And then the blood comes back from the lungs through pulmonary veins. So here's the right side pulmonary veins. This is the left pulmonary veins. And they will deliver blood into the left atrium. And if you turn it around, you can see here's our pulmonary veins, right? And then it dumps blood into this structure. So all of this is the left atrium. So you can see it actually has the same color, right? This is the left atrium. All of this is left atrium. Right atrium. All of this is right atrium. Okay. So that's it. So on the back of the heart, you probably saw already that here's your esophagus and this is your trachea. In the chambers. One more thing here. This is your ligamentum arteriosum. It's also pictured here, this little white band, and that's just the degenerated ductus arteriosus, which diverts blood in a fetus from your pulmonary circuit back into the systemic circuit. So it's just a little route. This is a ligamentum arteriosum. So here's the opening up the right atrium. Inside, you have 2 little circles here and here, and that's just representing the SA node and the AV node. And then there's a number 55 along the wall, and that's going to be your fossa ovalis, which is the sealed up foramen ovale in the fetus that diverts, again, blood supply from the right atrium into the left atrium. Okay, so that's basically it for the right atrium. If we open up the other guys, so we're going to open everything up. So we have a right ventricle, we have the tricuspid valve, chordae tendineae, that attach to papillary muscles, which I guess is these guys. Trabecula carne, the texture of the walls here. Then we have this pulmonary semilunar valve that delivers blood. Blood goes through here, comes back from the lungs, goes into the left atrium, goes through the bicuspid valve, still with chordae tendineae, and should be attached to papillary muscles. And then from here, the aortic semilunar valve is actually way up in here. So you can see it, but you have to tilt up the heart, so it's there. Okay, here's our interventricular septum. Apex of the heart, base of the heart. Did I forget anything?
Purkinje fibers.
You can't really see them, right?
There,
this white. Oh, yeah. Okay.
And then bundle of his, left and right.
Oh, there's right there. I never even looked at this closely. Yeah, there's our bundle of his, and there's our Purkinje fibers going up.
What pectinate muscles?
Pectinate muscles are muscles within the walls of the here, atria. But
moderator
they're
bands?
We're not covering. I'm not covering
No?
that right
Okay.
now. Yeah. That's it. Yeah.